Just give me 1 second. Where it started. Excellent. Okay, so it is 10:30, and I'm somebody that starts on time and ends on time. So my name is Deneen Diamond. I'm the lead for the Center of Excellence for Health. I'm super excited to be kicking off Allied Health Week. I am here at MBCC doing a live tour with students from St. Malachy's, and now I'm here doing a virtual session with our very first guest speaker, who has been working at Horizon for the last few years, and she's going to be telling you all about that. Her name is Erin Mclean, and she is an occupational therapist, and she is going to explain what she does, where she's from, and maybe give you a little glimpse of the day in the life of an occupational therapist. So from the Center of Excellence, thank you so much for being here. Super excited to have you, and I know that Erin is going to give us a good glimpse of what she does every day. So without further ado, I'll hand it over to Erin.
Okay, we're ready to go. Perfect. Thanks, Deneen. Thank you also for inviting us to be part of this Allied Health Week. I think it's great to educate young minds on what allied health professionals are out there. So like Deneen said, my name's Erin, and I'm an occupational therapist. And today I'm going to walk you through a typical day in the life of an OT, what it takes to get there, and what a career in OT means. So first, I'm sure a lot of you are seeing occupational therapy and wondering, what is it? I also felt the same way, didn't have a clue what it was, and probably every day I still explain what occupational therapy is to somebody, whether that's someone in my home life or someone here in hospital. There's many people who don't know what occupational therapy is. So hopefully at the end of this, you'll have a better idea of what it is and what we do. So we'll get started. I'm going to just make sure, see if I can get this to work. This is not my area of expertise. Perfect. Okay, so first you're going to learn a little bit about me, what training and education is involved in becoming an OT. Then we'll look at like my skills and what led me into the field of OT and how they relate. And then I'll take you along my career path of the last 14 years working as an OT here in New Brunswick and for a short time in Nova Scotia. And then we'll finish up with some advice and tips on what you might find helpful if you're interested in a career in occupational therapy. So what is OT? Occupational therapy is a type of healthcare that helps to solve the problems that interfere with a person's ability to do things that are important to them. So like everyday things. So we look at areas of self-care, so getting dressed, eating, moving around your house, to being productive. So whether that's going to school or work or simply participating in your community. And then we also look at the individual's leisure activities they like to enjoy. So sports, gardening, or social activities. So to be an occupational therapist, it is required that you have a master's degree in occupational therapy. And prior to the master's degree, you have to complete a bachelor degree. And there's no specific discipline you have to complete that degree in, but oftentimes people will take like kinesiology, science and kinesiology, straight sciences, psychology, arts sometimes, but then you often have to like supplement with a few extra of those anatomy courses or something. So oftentimes they go more towards kinesiology or the sciences. So like I said, some programs across Canada require specific courses to get in, and really it differs between every school. So it's important if you're considering it and when you're in your undergrad to look at those schools and find out what the exact requirements are if you're thinking of applying to those for your master's. And then, so a fun part of the OT master's program is that you complete 3 full-time, so they're 8 or 9 weeks placements in the workplace. And those can happen all over Canada and sometimes internationally as well. So that's, I think the total of it is 27 weeks or something in the workplace. So you get some really great on-site experience. All right. So here I am. Like I said, my name's Erin. I've been working as an OT for 14 years. My personal interests are skiing and traveling. And as you can see, this is my little family here. I'm a mom of 2 kids who are super active into tons of activities. Interestingly enough, all through high school, most of my undergrad, I thought I wanted to be a physiotherapist. So that's what I was striving to do. And I had, up until 3rd year of UNB, I was telling everybody I was applying to physiotherapy school. And then one day, during a course that I was taking at UNB in my undergrad, I had a prof that said, you know what, I think you would really like occupational therapy. And I looked at him and said, what is occupational therapy? And I had no idea what it was. And he explained it the best he could. But then I went to an education session that they held at UNB, and I learned a lot more about it. And it was very intriguing to me. And I never looked back. I didn't apply to physio school. I just only applied to OT school. And I am super happy that I did. So some of the skills and passions I possess to help me daily in my career include, I would consider myself a problem solver. I like challenges and figuring things out, like building puzzles and building things and doing puzzles. I like to help find solutions to problems. So I think that problem solving is one of my big skills that I have that lead me to being an OT. I'm caring. I've always loved helping others and working with others. Even like in high school and middle school, I babysat, and then I worked in a nursing home, and I always liked working with people. So when I was making this presentation yesterday, I asked my kids what skills they think I should add, and my son said, "You're a helper," and I was like, that's a really, really good point. I'm often found helping others. And my daughter said, "You are fun." And I also think that's another important one when working with people every day. And so it's important to have the energy and abilities to interact with people on a daily basis. So lastly, interpersonal skills. I would consider myself very social and an outgoing person. I like working with others. And I think it's an important skill to have when working in a career of occupational therapy, because every day you're going to interact with people all day long, whether it's your teammates, your patients, just hospital staff, community staff, school staff. Like, you're in the schools, you're in the hospital, so you're always around people. So you have to want to work with people and enjoy working with people. So next, this is a little bit about my career portfolio. So currently I'm working for Horizon Health at the local hospital in acute care. So basically for acute care, that's helping people return home after being sick or injured. So that's currently what I'm doing. I've been doing that for about the last year. Prior to that, I worked with children in the preschool population in an outpatient setting. And I also did a short stint, about a year at the IWK. And then prior to that, I worked with the extramural program, which means I was working in the schools and in people's homes. I have a little bit of experience in everywhere. So, one thing I would say, love-hate is a strong thing, but it was a good contrast. So one thing I love about my career is that we help people regain their identity and their independence. So it's really nice to be able to work with people and see them progress and see how much joy that brings to them after an illness or an injury, when they're feeling down or they're feeling like they're not able to do something, but then we come in and we help them sort of regain that level of independence to get them back home so they can perhaps live on their own, or maybe they need to take care of their children, or maybe they need to return to work, but we see them like grow, and it's just such a good feeling to be able to help somebody. So a dislike, so we're still very much a growing profession. We still every day are educating people about what is OT. And so that often comes with like advocating for your profession, hoping to advocate for new roles in different areas so that we can cover more service areas. So unfortunately, at this time, there's not enough OTs to meet all the needs, but we do our best and we carry some heavier caseloads, but we are always advocating to get new staff and new positions. So areas of practice. So there's different areas of practice. So you can work in physical health only, you could work in mental health only, or you can work in a combination of them both. There's pediatric settings, there's adult settings, there's geriatric settings. So there's also hospital settings versus community settings. So you could be a community pediatric therapist, you could be a community adult therapist, you could work only with the aging population, maybe at the veterans unit where you work with geriatric population. You could work in a hospital setting where you work in acute care. There's also strictly a mental health inpatient therapist. So there's lots and lots of options even within occupational therapy. So I went into occupational therapy, didn't know what I wanted. Obviously, as you can see, I was trained in all areas, and I've worked in peds, I've worked in community, and I've worked in now in acute care and adults. So I would explain that occupational therapy, like, you have very strong relationships, so you can work in a team and you can work with others, or you can just work amongst a team and do sort of your work more independently. And right now, I would say in acute care, that is more of how it's operated. I work closely with a physio, but most often we do our assessments, then we collaborate together as a team, and then to meet the client's goals. However, when I worked in peds, we worked strictly in a team, and we saw the patient as a team, and we did things more cohesively. So there's those options as well. Looking back, I guess, and I kind of touched on this, but I was like hoping that I would have a better understanding of the diversity of the profession and the different job opportunities. So when I came out of OT school, I had three job placements, all kind of like in the same sort of adult population. Peds placements were harder to come by. At the time, mental health placements were harder to come by. So I did sort of acute care, rehab, and also in the geriatric population. So, I mean, I got a wide set of skills. I got all different kinds of views of what it was, but I still didn't have experience in some of the areas that I wished I had. That being said, I still went into pediatrics. I still had the skills for the job, just hadn't had any like firsthand experience of it. So my career path was that I did an undergraduate degree at UNB in science and kinesiology. I then did my master's of OT at Dalhousie University in Halifax. And then I had 3 work placements during that time as well, all in different areas, like I said. So just trying to make sure I touched on sort of everything on that slide. So a day in the life of what I do. So first, over my span, I've worked, like I said, in pediatrics. So I worked with preschool age children, ages 0 to 5 years old. I work with children and their families to help them gain their independence and strengthen their developmental skills. So oftentimes people think occupational therapy is only related to occupation or the person's work. But as OTs, we think of occupation as any meaningful activity. So to a child or to a child's family, sometimes that's eating, sleeping, playing, learning how to hold writing tools, some of those things. So we also work with children with mobility concerns. So sometimes we have to prescribe wheelchairs for those who may be delayed in walking or may not ever develop that skill. So pediatric OT requires a lot of energy and a lot of enthusiasm, because when working with young children, you often have to get creative on how to achieve the desired outcomes when letting them know they're not really doing any work. So it's super play-based. You really are just trying to achieve your goals during play, or obviously like even with feeding. Sometimes that's a very challenging skill for kids to learn. And we often take the focus off the stress of eating and just focus on playing and touching the foods and exploring the foods. And we really like try to get messy and dirty and make it fun and make it seem like to the kids that they're not really doing any work. So then that was 10 years or so I spent in pediatrics. I also did a short stint at the IWK when my family and I moved to Halifax for a year and a half. That was similar position. I did mostly outpatient rehab. where I saw the kids in the clinic and they came into me. And then I had a small little inpatient population as well. So that was more acutely sick children who we were working on trying to get home. So when I moved back to Fredericton, I made quite a big career change, and I came into acute care here at the hospital and started working here at the deck. So a day in acute care involves prioritizing. So every day we come in, we get a stack of referrals, and we kind of have to prioritize sort of what has to get done that day. So we have a certain list of high needs that need to be addressed sort of immediately or within a 24-hour period, and then other items would sort of prioritize less and less on, say, someone's being discharged in like a few days, or you know, it's more long term, they're going to rehab, whatever. So we work with individuals to regain their independence and ensure they're well set up for home when they are medically discharged. So for example, a surgery such as like a leg amputation changes how you will move around your environment and how you will complete your activities of daily living. So bathing, dressing, cooking, all those things are going to look very different than when you came in and you had both of your limbs. So we would help the individual try to become as independent as possible. So of course, yes, it's going to look a little bit different than what it did before they came in, but we are going to look at what equipment can we provide them to help them be as independent as possible. And most often, those individuals go home and are just as independent as they were when they came in. So they get a wheelchair for their mobility. They get some bathroom equipment so they can get in and out of their shower. And they get some dressing aids. So if they're not able to reach their lower limbs, or if there's other things they need help with, we have aids in hospital or aids that we can prescribe that can help them do most activities that they were able to do prior to coming in, but now looks a little different when they're being discharged. So I guess I got these a little mixed up. First, I started my career in community, but only for a short time. So I worked in schools and in the community in people's homes. So what I really liked about community setting was that you get to see the individual in their natural environment. So they're not in hospital, they're not in an outpatient setting where they come in. You get to see them and how they function in their own home or in school, which was for the pediatric population. So again, it's very similar. You work with the individual to regain independence. However, the injury or illness is just not as acute as it is in hospital. So they are more medically stable, which means they can be in their own home, but perhaps they need further rehab following an injury and illness to get them back to their previous level of functioning. So what I mean by that is that they are feeling well, they're working hard, and they are trying, they might be, so example, I'll give you an example. So like maybe a fractured arm, leg, hip, whatever. They are medically stable to go home, but that doing things at home isn't going to look the same because they have a broken limb. We would work with them to try to get to be as independent as possible, but we might have to use some adaptive devices or a piece of equipment in their bathtub, on their toilet, to make them more independent, to make them be able to do those things on their own like they were doing before. So community was a short time for me, but one of my favorite parts of community was that you got to see the patient in their natural environment. So that was one of my favorite parts of that. Okay, so might have gone really fast through this, but so that is just a snapshot in time of me, of my career in the few areas I've worked in. Again, like I said, I've not ever worked in mental health, although you do mental health, sort of, it overlaps with many physical health, but specifically I've not worked in the mental health field. I've not done any placements in a geriatric facility, and not sort of done any adult rehab therapy either, other than just the acute care. So there's lots of areas I still haven't even practiced in, and there's many areas I have practiced in and that I tried to give you sort of a snapshot of. So some advice I have for you if a career in OT is intriguing or you wish to learn more is to job shadow. So occupational therapy practice is available all over the world. I was fortunate enough to be able to complete one of my work placements when I went to Dal in Australia. And I got to witness firsthand how our practices are very similar, whether here or in Australia. I know I had classmates that went to Africa and did a placement, and all of us could come back and share that OT practice is the same all over the world. That's pretty cool. I guess my suggestion is I encourage you to reach out to Horizon Health Learning Services to request a shadowing experience. So if there's anything you think you might be interested in, maybe not OT, but maybe it's physio, or maybe it's speech language pathology, or maybe it's respiratory therapy, or some of the other ones that are going to be offered this week, reach out, do a job shadow, and get firsthand experience of what they do and walk through with them their day and what it looks like. You'll get a good idea of if this is for you, if this is not for you. So one of the other things that I'm very strong advocate about is opportunities in your co-op placements in high school. So I did a co-op placement when I was in high school, loved it. Obviously did it at a physiotherapy clinic. That's what encouraged me to want to be a physiotherapist. And it turned into a part-time job, and I worked there all through my undergrad in the evenings, and they were super supportive, and that was sort of leading my choice in physiotherapy. However, then along came occupational therapy as a suggestion to me, and I did take the leap. But again, it was that brought me sort of full circle into an allied health profession, because I got to gain firsthand experience of what it was, and sort of have a good understanding of what a career in that profession could look like, which is very important. You spend a lot of time at work, and you spend a lot of time in a career. So it's nice to be able to work when you work hard for your education, to then enjoy sort of what it is you are actually doing on a day-to-day basis. So I am more than happy to open this up for questions. And
if you have any questions, you can put them in the chat, or you can just speak out as well. Or Jennifer, if any of your students have questions, you can ask on their behalf. So nothing right now, but like Erin said, I think if we have any questions, you can go back in and put them in the chat here, or Erin has shared her email to pass those questions along. Did you have any final words, Erin?
No, I don't know. I hope that was okay. It kind of gives you a snapshot of what OT is. But again, I just encourage you to reach out to your local learning services at your local hospital. I don't know, are we all over New Brunswick?
Yes, we are.
Yeah.
So I'm going to put that in the chat, a link to our education placement portal, which is where if you're interested in learning a little more about the profession in a more hands-on environment, you can submit a request, and it actually comes to my team, and we'll coordinate that for you.
Yeah, I think it's great opportunity to do that. I'm certainly happy to, you can take my email down and you can send me a question if you're in the area. Great. I can certainly direct you towards the person you may want to speak to if you have a certain area of practice. And then I'll help you out certainly the best I can. I'm a huge advocate for OT.
Absolutely. Perfect. Well, thank you so much, Erin. Oh, wait to see if the students have anything.
Any questions? No?
Okay, well, thank you so much, Erin, and thank you for everyone who has signed on. This session is being recorded, so we are excited to be able to share it on the Center of Excellence website. If you have other students that would like to see this outside of this forum, it does look like maybe there is a chat coming through.
Sure, we can wait a minute.
If we attend. Oh, they were just saying thank you. Perfect. V, did you have anything that you wanted to add?
Yeah, so I just want to say thank you too. And Erin, that was such a good job. It was wonderful. I learned so many things. And for the classes that attend, thank you so much for taking your time and doing this. And we have more speakers coming up this week. And if you check out our website, I put it in the chat just to get more information. Thank you.
Thanks so much.
Have a great day, everyone.
Thank you.
I'm really